Okay, let's look at this idea of lower extremity neural tension with the straight leg raise sign. What I did was hook some surgical tubing up to the skeleton on the nerve root here just to show you. So again, in context, what happens with some patients when you go through and do a straight leg raise on them, reproduces their leg pain, nerve pain in their leg because of that neural tension. When you're looking at dural tension, often when you ask the person to flex their head, it increases their leg pain, which makes sense because then you're increasing the dural tension throughout the whole system, right? You're flexing the leg from below, you're flexing the neck from above and putting them in this slump position from neural tension. However, in many cases, when you bring the patient's leg into a straight leg raise and they're symptomatic with nerve symptoms in their leg, you ask them to then flex their neck, their leg pain goes away. And that's kind of a mystery to lots of clinicians. It's like, why does the leg pain go away? Here's one proposed idea with, again, a rubber band and a piece of surgical tubing on. So if I take a nerve root, again, non-specific nerve root, sometimes what happens is when you're pulling on that whole lower extremity sciatic nerve lumbar plexus, is you're pulling the nerve, let me pull like so, you're pulling the nerve and it's kind of hitting on something. So I just took a rubber band and put some green on a rubber band in here. So you pull on that nerve, it comes out, and then you're kind of abutting or hitting maybe an adhesion on a local structure here, on a ligament, or in that sheath itself, but you're hitting some kind of noxious adhesion in through here that creates that nerve pain in the leg. So if I pull the nerve away, it hits the green object, which is causing pain. And then when the patient then flexes from above, they flex up, it actually pulls back in, taking the pressure off of that nerve root. So they pull it back in, pressure comes off. When they're neutral and you pull down, you're hitting on that green adhesion area, causing pain. You keep the tension in the leg, but they pull back and it actually slides it back off of whatever is causing pain in that area. So it's not just neural tension, but it's almost like the nerve gets snagged on something that causes pain when you pull it in one direction. Hopefully that will help.